Welcome, everybody. My name is Terrence Shenfield, and I will be your speaker for today. This particular topic, called complementary medicine in cardiovascular disease, is a very interesting topic. So many people today are dying of heart disease. It's the number one killer in this country. And I wanted to share with you some of the integrative and holistic approaches to managing cardiovascular disease. My background is I'm an education coordinator for respiratory therapy for the last 30 years. I also received a master's in complementary and alternative medicine with a focus on herbal medicine and essential oils. So I know a lot about integrative medicine, and I wanted to share this with you, and I think you'll really enjoy this presentation. Today's objectives are: I'm going to describe the role of complementary and integrative medicine in heart disease. I'm going to describe the different modalities and which one are really effective and evidence-based. I come from a background of being an education coordinator, and I come from a background like, where is the randomized controlled trials? Where is the evidence? Where is the evidence? Where are the evidence? So some other objectives: I'm going to talk a little bit about diet and exercise. I'm going to talk about the topic of functional foods, speak a little bit about herbal medicine, speak a little bit about aromatherapy, and I'm going to also describe some relaxing techniques. When you think about relaxation techniques, you got to remember there are some people who have the type A personality who cannot unwind, and as a result of that, typically they get hypertension, and this leads to a whole cascade of other issues. So, what exactly is complementary and integrative health? The National Center of Complementary and Integrative Health, which is called the NCCIH, is actually funded by the NIH, the National Institute of Health. The amount of money that was spent each year in budgeting went from $20 million a year all the way up to $113 million a year to conduct research on complementary and integrative therapies that have been shown to improve the health of Americans. As you know, many of us use some form of complementary and integrative therapies. I am sure many of you out there sometimes might use some kind of meditation. You might also take some herbal supplements. I'm sure you all take a multivitamin. And there's so many different things, like garlic is good for your blood pressure. Beet juice has been shown to lower blood pressure too. Also, beet juice is used as a detoxifier. So the medical community sort of frowns upon the word complementary and alternative medicine, so they really sort of like the word integrative health. That seems to be the buzzword, and many medical centers have opened up integrative health centers. But most of the research you're going to find out there is from the NCCIH. They're well funded, and they actually conduct some very good studies. And in this particular case, we're going to talk about cardiovascular disease and different modalities used to treat it. So I have a question for you. How many Americans do you think really practice complementary and alternative medicine? And I think you'd be very surprised that 38% of all adults and 12% of all children use some form of complementary and alternative medicine. Actually, there's a budget of over $34 billion a year. A lot of manufacturers are making a ton of money with supplements and these miracle herbal remedies. And who's to say what's working and what doesn't? In regard to complementary and alternative medicine or integrative care, it seems like women predominantly use the system much more than men, and most of them are in middle age. Typically, they are better educated, they have higher incomes, and they really practice all these forms of alternative medicine. The funny part is that complementary and alternative medicine or integrative medicine is carried out in many countries in the world. For example, you have all heard of Chinese herbal medicine. Almost 60% of the country in China practice herbal medicine. In India, they have a medicine called Ayurvedic medicine, and typically 60 to 70% of the population use these herbal remedies for care. We in the Western Hemisphere actually practice medicine from the American Medical Association. And trust me, there's a little bit of a pushback from the American Medical Association, and sometimes it's warranted. Sometimes there's some herbal remedies that can really create some harm, or you might just believe that it's going to work better than a pharmaceutical drug. So the choice is pick the right ones, pick the ones with evidence, and learn as we go along. The prevalence of cardiovascular disease is enormous. Cardiovascular disease is the leading cause of mortality in the United States for both men and women. There's approximately 600,000 deaths each year as a result of it, and that represents 1 in 4 deaths in America. The most common form of cardiovascular disease is coronary heart disease, which kills more than 400,000 people each year and costs U.S. around $110 billion each year. Some of the risk factors for cardiovascular disease is hypertension, high LDL cholesterol, smoking, diabetes, being overweight, poor diet, physical inactivity, and excessive alcohol use. Despite the growing interest in CAM for cardiovascular disease, there's very little data showing exactly how many people use it. They estimate that almost 17 to 18% of all patients out there with cardiovascular disease use some form of herbal products such as echinacea, garlic, ginseng, ginkgo biloba, or glucosamine. And they also do mind-body therapy such as deep breathing and meditation. So the use of CAM is really predominant, and most of it is focused on herbal remedies and dietary supplements. They conducted a very interesting survey at the Mayo Clinic. This was at the cardiology outpatient clinic, where they did a 17-question survey on 1,755 patients. Basically, what they were looking for to see if any of these patients were using currently or have ever used or considered using CAM therapy. CAM, complementary and alternative medicine, and also the use of dietary supplements. So if any of these patients in the survey answered yes to any of these questions, they were incorporated in the survey. And those questions were, number 1, do you suffer from angina? Number 2, have you ever had angioplasty? Or number 3, have you ever had heart stents placed? Or number 4, do you ever have chest pain that you have to use nitroglycerin? And number 5, did you ever have a heart bypass surgery? So if you answered yes to any of those 5 questions, you were incorporated in the survey. And let me show you the next slide that shows you the results of that survey. It's kind of interesting, the results of the survey. This particular slide talks to the use of dietary supplements. And it seems that fish oil and omega-3s was the #1 choice if you had any kind of cardiovascular disease. They also used coenzyme 10, which actually is very good. They talked about increasing fiber in the diet, such as eating oatmeal. And they actually talked about the use of hawthorn. And hawthorn is way at the bottom of the list. And that's kind of funny because hawthorn, which not many Americans know about, is an excellent herbal remedy for heart disease. So as you could see, fish oil, omega-3s, multivitamins, all the way down the list, and it shows which kind of herbal remedies and supplements are being used. This is a very interesting slide because this talks to the use of mind-body use of alternative treatments. Now, when I say mind-body, think of relaxation, stress management, meditation, yoga, guided imagery. And as you could see, for those who have heart disease, relaxation techniques, stress management, meditation was, around maybe 7% of the time used. And a lot of times, these mind-body techniques can control your blood pressure. So, really it's being underserved in this population. This slide speaks to biologically based therapies. And at the top of the list comes the marine derived omega 3s. Basically, we're talking fish oil. And surprisingly, there are some big studies done on fish oil with heart disease, and they found that it's not that effective. I'm going to speak more about that a little bit later. You've heard of garlic. Garlic actually lowers blood pressure, and it is true. Coenzyme Q10, there's some really good evidence showing that this works for cardiovascular disease, and actually it works by reducing oxidative stress. Then we get into hawthorn leaf, which not many people have heard about. But throughout the world, hawthorn leaf is one of the #1 herbal remedies for heart disease, and especially for chronic heart disease, and it really, really works very well. Now, many people take antioxidants, and antioxidants come in many forms. So, think of your colorful vegetables and fruit, and there's a whole host of benefits that come with that, like anthocyanins, which come from berries, and you got beta carotene from carrots and catechins from actually green tea. You got coenzyme Q10, flavonoids, lipoic acid. There's a whole list of great antioxidants. Antioxidant therapy is a wonderful choice to keep yourself healthy. It actually reduces the inflammatory process and it works wonders. Another good choice is red yeast rice, and actually they've done some studies with that where it lowers your LDLs. And many people talk about the use of soy protein and also isoflavones, which actually reduce CVD mortality. So I'm going to go a little bit more detail into each of these things, but this is a laundry list of biologically based therapies. In cardiovascular disease, I cannot understate the importance of diet and exercise. We all know this. We hear this all the time. It comes on the TV. It comes on the internet. No matter where you hear from your friends, everyone's telling you you got to eat right. You got to do more exercise. And the fact is, it's true. And I could just give you a couple of hints about eating. If you're going to eat, try to eat a variety of colored fruits and vegetables. And for example, a yellow pepper, a red tomato, a green broccoli, a purple rhubarb. All of those different colors actually represent different components in the fruit that offer antioxidant qualities. So really have a variety of color. Don't try to be stagnant to one particular fruit or vegetable you like and you eat it every day. Really add a lot of different color. Me personally, I love blueberries. I buy frozen blueberries, and they are purple in color, and they have what is called an anthocyanins. Anthocyanins actually show a 30% reduction in the likelihood of getting cardiovascular disease if you intake it every day. Again, you should take grain products. Oatmeal is a good choice. Not that you have to eat oatmeal 7 days a week, but oatmeal actually has a lot of fiber, and when you eat it and it goes through your intestines, all the fat that goes through your intestines actually, instead of being absorbed into your body, gets absorbed into the fibrous part of the oatmeal, and you pull it out. Eat just a normal amount of fat. Chicken, fish, even small amounts of red meat are fine. You don't need to have a 16-ounce steak. You can be very happy with a 4-ounce steak. I've been practicing that now recently in my life. In my younger day, I would probably overeat too much with my steak, but right now I'm sort of decreasing it. I think it's 1 gram for every pound you are of protein. That's what you should have. And definitely do some kind of exercise. Walk, do yoga. I like lifting weights. I lift my weights about 3 times a week. I also ski in the winter. And my problem is I love to eat too much. I got to learn a little bit more dietary control. There's a term, and it's called functional foods. Now, many of you may have never heard of functional foods, but I'm sure some of you have. But functional foods are foods that have a benefit to you besides offering you calories and minerals and proteins. For example, we all heard that green tea is good for cancer. It's also good for arthritis. We all heard that grapes is actually very good, especially red grapes, and wine is good for heart disease. We all heard of oats, like oatmeal is actually being good for heart disease, and actually how it works is because of the fiber. So there are many different types of functional foods, and they have done a lot of good studies with functional foods. And some of the biggest ones are soybeans, oats, flaxseed, garlic, tea, fish, grapes, nuts, stanols, and all of these have shown to be actually excellent foods. There is a growing consensus that systemic inflammation is at the heart of cardiovascular disease. Inflammation is a key feature of the immune system functioning to defend tissue integrity and function. However, chronic stimulation of inflammatory mediators lead to long-lasting vascular reactivity, insulin resistance, hyperlipidemia, and subsequently heart disease. So dietary practices to minimize the inflammatory response are really, really important. So if you take certain functional foods, such as the ones just mentioned on the screen, there's a lot of good studies showing that it lowers your blood lipid levels. It actually improves your arterial compliance. It reduces low-density lipoprotein oxidation. It decreases plaque formation. It actually has super-duper antioxidant that scavenges free radicals, and it actually inhibits platelet aggregation. All of these things really point to a healthier body, a healthier heart. So we'll get a little bit more into it. And just remember, the word is functional foods. A lot of manufacturers want to sell you functional foods in a bottle. They want to sell you functional foods in a package. They want to infuse some normal food with functional food. So the point is this, you don't need to do any of that. All you need to do is when you go shopping, make sure you go to the fresh fruit and vegetable section. And I cannot stress enough that you need to eat a variety of colors. In other words, you have to have a rainbow of colors to get all of the benefits that come from food. For example, when you eat red fruit or vegetables such as a tomato, a pepper, an apple, they are loaded with flavonoids, lycopene, vitamin C, and folate. If you eat any kind of orange or yellow vegetable, think of squash, think of a pepper, think of a carrot. They are loaded with beta carotene. They have vitamin A, vitamin C, and then you get your green vegetables. And green vegetables can come in the form of a cucumber, it can come in the form of broccoli, it can come in the form of lettuce, and so on. And they are loaded with known as chlorophyll, vitamin K, carotenoids, and a host of other flavonoids that work very well in the body. And then you want your purple and blue vegetables. I did some research on the use of anthocyanins, which are found in purple and blue vegetables and fruit. I particularly like blueberries, and I read some good studies, as I mentioned before, that if you consume a half cup of blueberries every day, and they can be frozen, they don't have to be fresh. Frozen fruit is just as good as fresh fruit. It actually reduces the likelihood of cardiovascular disease by a third. So I do it every day, and you know it also how it works. It's an antioxidant. It works great. And then you got your white vegetables. White vegetables come in the form of potatoes, and they're loaded in what is known as flavonoids. Flavonoids, lycopene, beta carotene, chlorophyll, anthocyanins. All of these are functional foods. You don't need to buy prepackaged or juiced functional foods. Get them in the vegetable shop, buy them, eat them, and your heart will be a lot happier. Let's talk about garlic and heart disease. You know that garlic wards off vampires, but actually it protects the heart too. And I just wanted to make a clarification here. There's a difference between the garlic you buy in the store and the garlic they do in studies for heart disease. There's a term called aged garlic supplementation, or you can make a garlic tincture. The difference is if you get aged garlic, which I'll explain a little bit more to you, and if you create a garlic tincture, you get much more benefits. Studies have shown that the use of garlic actually reduces hypertension and reduces cholesterol. Studies also show that with the use of garlic, you can reduce your C-reactive protein. C-reactive protein is an indicator of inflammation in your body. Other studies have shown reductions in blood pressure, both systolic and diastolic. They actually show reductions in cholesterol. They looked at 8 different meta-analyses. If you're familiar with studies, you got a randomized controlled trial, which is like one study, but you could look at a meta-analysis. A meta-analysis is actually grouping multiple studies. So they looked at multiple studies with the use of garlic for reduction of cholesterol. All of them pointed to being positive. Actually, it's shown to reduce cardiovascular disease by lowering cholesterol. It also inhibits what is called as platelet aggregation, and it actually works by lowering blood pressure. A typical dose for garlic, of aged garlic, is around 2,400 milligrams each day, or you could use a tincture. And I'm going to give you a great recipe for making your own homemade tincture of garlic if you want to keep your heart healthy. As I was mentioning before, I don't think you could really consume so much garlic in your cooking that to really show a real benefit to you. You could. You got to cook every meal with garlic, or you have to cook quite often with garlic. I know it's not practical to do that. Now, you could buy supplementation, which is called aged garlic extract, or from my point of view, you can make a garlic tincture. You may be wondering, what is a tincture? The picture on the screen says it all. Basically, what you do is you get enough garlic to fill a half bell jar. So you get some fresh garlic, you crush it, or put it whole, cut it in pieces. You fill it halfway with the jar. Then you add vodka to the top, and you say, oh my goodness, why am I doing the vodka? What happens with the vodka actually draws out the constituents or the chemical benefits of the garlic. So what you do is you put vodka to the top, you put a lid on it, you put it in a cabinet for 4 weeks, and like maybe every couple of days you shake the jar to mix it up. And then after 4 weeks, you strain and filter out all the garlic particles. And what you're left with is a tincture. And this tincture is actually the beneficial part of the garlic. And all you need to do is take like a tablespoon in the morning, a tablespoon at night, and it will be a mixture of garlic and vodka. It's, you're not doing this for the alcohol to get drunk, but it will last up to 2 years. You should store it in a brown bottle. And the reason for the alcohol, you can't do this with water because alcohol has the ability to extract the chemicals that are in the garlic that are really beneficial to you. So this is called a garlic tincture, and it's very simple, very inexpensive to make. As we have all heard, fatty fish is really good for the heart. And you wonder why the people in the Mediterranean region who eat a lot of fish have a low incidence of heart disease. And we extrapolated from that it's the fatty fish they eat. So as we do in America, we decide to take the oil from the fish and put it in a pill because we are a pill society, and that we would use fish oil. And to tell you the truth, I don't have no cardiovascular disease, but I was taking fish oil myself for a number of years. And then I picked up on this study. There was a huge meta-analysis done from 2013, and I explained to you what a meta-analysis is before. And they looked at 16,000 patients, and this contained 14 randomized controlled trials. And they determined from that fish oil was not associated with a reduction in chronic heart disease, and it did have a protective effect on heart. So what it means is fish oil is not as made out to benefit as much as everything else. It could be in the Mediterranean, they do more walking, they have other foods they eat. It could be the proportions of food, but results have shown that fish oil does not exert a protective benefit with cardiovascular events. It does exert a beneficial effect in reducing death from cardiac causes and sudden cardiac death, but it's not that beneficial. And they actually felt that the intake of fresh fish is better than taking a pill. So I think we got to get away from that pill society that we want to take a pill and everything's going to be better. If you want to introduce fish oil into your diet, have yourself some fish at least once or twice a week, and you'll find that you might get some benefit from that. But overall, the evidence does not support the taking of fish oil tablets. Of all the herbal remedies I'm going to tell you about today, nothing is better than hawthorn leaf for congestive heart failure. Typically, when you have heart failure, there are many drugs used to manage it, such as diuretics, beta blockers, calcium channel blockers, ACE inhibitors, and so on. All of these medications have significant side effects. So in the rest of the world, in India and China and other countries, Germany, they have been using hawthorn leaf for congestive heart failure. There are many reasons why it works. There are different diagnoses for heart disease, such as coronary artery disease, where the arteries become narrowed and restrict blood flow. Heart attack is another reason for heart failure, where the walls and muscles are damaged and the pumping mechanism is less efficient. Congestive heart failure is where the pumping of the blood is inhibited and it's not pumped out efficiently, which causes venous congestion and peripheral edema. There have been a number of trials that have shown that hawthorn had a significant benefit versus a placebo in regard to CHF. A good meta-analysis was done by Pitter, and it demonstrated very positive results of those who suffer from heart disease. So hawthorn works wonderful. There's also studies of hawthorn for hypertension. High blood pressure or hypertension is a significant risk factor for death. Blood pressure is determined by the amount of blood the heart pumps out and the resistance of the arteries to the flow. Many studies have shown that with the use of hawthorn, it increases the flavonoids. It also increased the nitric oxide synthase, which results in better walls, better release of vasodilation and lowering of blood pressure. Another benefit is the antioxidant effects of hawthorn. The protective effects of hawthorn comes in from the chemical constituents in it, and they found that the leaf of this plant actually works very powerfully as an antioxidant, and this actually reduces oxidative stress. Another benefit of hawthorn is the positive inotropic effect, which actually what that does, it improves the contractility of the heart. And as I was telling you before, it has a very strong anti-inflammatory effect, as inflammation is a very important element in heart disease. There are many risk factors that lead to inflammation of the vessels and the muscles of the heart, such as diabetes and smoking. And they found that the use of hawthorn leaf is actually very good. It actually increases the interleukin-6, which has been shown to downregulate the pro-inflammatory mediators. There's also antiplatelet aggregation effect, which means that the cells don't clump up together and you don't get no clots. And it has actually lipid-lowering effects of too. So as you can see, hawthorn leaf is a very powerful herb, has a lot of good studies. If you want to do some more research on it, I would suggest all you got to do is go to Google Scholar, and you're going to find a ton of stuff with it, and there's very little side effects. I'm not sure if you've heard of red yeast rice. Red yeast rice is typically used in actually Chinese herbal medicine as well as culinary. They actually cook with it. It has a long history of lowering cholesterol and lowering lipids. The funny part about red yeast rice is that it contains this chemical called monocolin K, which has the exact same structure as a statin. So actually this medication or this red yeast rice actually has the same molecular structure as a statin and actually has the same type of impact on cholesterol. Studies have shown that red yeast rice can reduce serum LDL levels by 10 to 33%. But the problem with this is because there's no FDA regulation of it, the consistency of the product can vary from one manufacturer to another. Another problem with that is that it contains this thing called citrulline, and citrulline has been linked to kidney failure. The FDA actually considers red yeast rice as a drug and not a supplement, and the typical dosage of red yeast rice is around 1,200 milligrams BID. So this is an effective use of this particular plant, and it's actually used to lower cholesterol and LDL levels. But sometimes, like I said, the products vary in consistency from one manufacturer to another. In Asian populations, there's a lower risk of heart disease and stroke. And a lot of people felt that the reason for that lower level was their diet. And their diet consists of a lot of soy protein and isoflavones such as tofu or bean curd or things like that. So people were doing studies thinking that the soy protein they eat actually has a heart protective effect. But it's kind of complicated because the Asian population also has a different lifestyle than us, and they actually eat more vegetables and they have a different type of mixed diet than us. But with soy protein ingestion, they showed actually a lowering of LDLs with its use. High intake was associated with a decreased risk of mortality from stroke, especially ischemic stroke. Actually, the supplementation with it has been shown as a decrease in blood pressure as a result of fibrinolysis and anticoagulation effects. So it really has some positive benefits that are out there for it. The typical dosage of a soy protein would be around 1,200 milligrams BID. Of all the herbal remedies that I mentioned, I really have a strong like for hawthorn and coenzyme Q10. Coenzyme Q10 actually decreases as we get older. So as we get older, our natural production of CoQ10 decreases, and also that's at the same time when we start getting chronic diseases. Actually, patients with ischemic heart disease and dilated cardiomyopathy have shown deficiencies in coenzyme 10. So you're wondering what's going on. So here you got all these patients with cardiac diseases, and all of them are having lower levels. So the thought was that the supplementation with CoQ10 would be a good thing. They actually showed that when you take CoQ10, it increased the levels of ubiquinol 10 with circulating lipoproteins. It has a very powerful antioxidant effect. And one of the side effects of CoQ10 is actually lowers the statin levels. So that's another concern with it. But like I said, CoQ10 normally decreases as we get older. It's also been shown to be decreased in patients with heart disease, and it's one of the most well-studied remedies for heart disease. So I would strongly suspect that anyone who has heart disease should seriously consider taking this as a supplement. There's a lot of evidence out there that people with stressful personalities have a higher incidence of heart disease and hypertension. Stresses come to us every day. Some people can manage stress better than others, but some people who can't manage stress end up having high blood pressure, and it impacts so many different parts of the body. A lot of times, if you're a very stressful personality and you don't eat right and you don't sleep right and you have some bad habits, it's going to really boost up your high blood pressure, which is not a good thing. So you really need to manage your stress, and there are certain ways to do it. You could sleep right. I mean, I could not tell you enough about the importance of getting 7 to 9 hours of sleep. You got to do some kind of exercise. You need to do some relaxation techniques. Now, not everyone knows how to relax. I mean, some people have to really work at it, yet some people could do it so naturally. So some of the methods to relax, you could use aromatherapy, which I want to tell you a little bit about. You could meditate. You could do yoga. There's a thing called journaling where, in other words, so you all got these bottled up feelings and anxiety. And what you do is you write down on a piece of paper what's going on, and when you do that, it sort of purges it from your body. You could pick up a hobby you like. Some people like gardening, some people like doing a little woodwork, whatever you like, but do something. And there's another term called guided imagery. Guided imagery is basically where you um, put yourself, you take some deep breaths, you slow down, you're by yourself, and you put your mind in a place that you really like to be. Like me personally, I love to ski, so I can imagine myself on the top of a mountain, just overlooking the whole valley and below, and it just puts me in a great place. You could also improve your social network. Why hang around with people who get you upset? It doesn't make sense. So, pick and choose who you're with. And also try to resolve stressful situations. I mean, stress is part of life, but how you resolve stress is really important. So what I'm going to really talk more about here is about aromatherapy, and especially its link to heart disease. As I mentioned, stress comes in many ways, especially for patients. Now, I don't know how many of you really know much about aromatherapy, but there's been some good studies showing that aromatherapy, which is a plant-based medicine, actually works very well for reducing stress. Aromatherapy will not replace a valve replacement. It will not take the place of someone who needs a cardiac bypass, but aromatherapy can control stressful situations, especially with hypertension and anxiety. But certain things can impact your health. Negative emotions, stress, have a bad effect on your body. It actually puts you in a sympathetic state of mind, which increases your blood pressure. You need to be more in a parasympathetic type of state to really heal. So they've done some studies with ICU patients where aromatherapy, such as the use of lavender oil or ylang-ylang or bergamot oil, actually improved sleep quality. It reduced anxiety, and actually decreased the use of sedation. Actually decreased a tremendous amount of sedation was reduced from it. There was actually small drops in blood pressure, of systolic blood pressure and diastolic blood pressure. And they did some studies with ICU patients who were going under a percutaneous coronary intervention. And obviously that's a stressful situation. And they actually benefited very well from aromatherapy. So aromatherapy can be utilized in certain settings, especially about reducing stress. And once you get home, and stress is not going to go away. We're always going to have stress, but at home, you got to find ways to relieve the stress and try to do it without chemicals. In regard to aromatherapy, I wanted to show you two types of devices that really can deliver aromatherapy. The top one is a device that costs about $30. And how it works is you take about a half cup of water, you put it in the base of that device, and then you put about 10 drops of aromatherapy, which say bergamot or lavender, and you put it in there and you plug it in. Now, the benefit of that is that you'll smell it real well, but the particle size, this should appeal to my respiratory therapist friends, the particle size there are so heavy and dense that you could see the mist, and the mist actually drops down to an area around 3 feet around the device, which means that if you're 5 feet away, you're not going to get the full benefit of it. The device on the bottom works as a aerogen neb. You've heard of the aerogen neb. It works on a piezoelectric mesh, And as a result of that piezoelectric mesh, you just put no water, it's just pure essential oil, and it vibrates at such a high frequency that it actually, you don't see the white mist, but it's dispelled in such small particles around the room, and you get a much better therapeutic effect. Some of the oils that are used for stress are bergamot, melissa, rose, Roman chamomile, lavender. All of these oils are wonderful for reducing stress, but what you want to do is avoid oils like rosemary oil and peppermint oil, which actually has a stimulant effect. Now, if you want to study for an exam, rosemary and peppermint are great for you. If you have a headache, peppermint oil is good for you. But under stressful conditions, bergamot, rose, melissa, sweet marjoram, they're all the best oils you could do. And lavender is the most studied oil, and it's the least expensive. So consider that too. I wanted to further this conversation, tell you a little bit about whole body medical systems. When you think about whole body medical systems, think of Chinese herbal medicine, but in India, they derived their own particular medicine called Ayurvedic medicine. It's very similar to Chinese herbal medicine, but it actually encompasses mind, body, spirit. And ask anyone from India, they all know about Ayurvedic medicine. As I said earlier, Ayurvedic medicine is still practiced in India today. In regard to heart disease, there are three major herbs that have been shown to be very promising. There's probably more, but with my research, I found these three. And one of them is called Terminala Arjuna. This is good for congestive heart patients. They actually did some clinical trials with this and actually worked very well. Another one is Gukalu. Gukalu is a cholesterol controlling medication. That's not I take the word, it's not medication, it's actually a herbal remedy. And finally, we all heard of turmeric. Turmeric is a wonderful herb that actually has very high potent anti-inflammatory qualities to it, and actually it has what is known as lipid reducing qualities. When you think of turmeric, you can really make the tincture with turmeric. You remember my showing you how to make a garlic tincture? You can actually make a turmeric tincture. This way you get the root of the turmeric plant and you put it in alcohol, and it really works very good as for an anti-inflammatory qualities and also lipid reducing. There's a thing called Shirahara, and Shirahara is basically the picture on the left where they take a medicated oil and they put you in the supine position and they drop this oil on your forehead or your third eye, and this is supposed to elicit some great responses and relaxation that goes along with whole body medical systems. If you're interested in Indian medicine, I'd suggest you read a little bit about Ayurvedic medicine. It's a really well practiced medicine. I practice this myself. Another type of whole body medical systems is yoga. Again, this is derived from India, and Hatha yoga is the most common that is practiced in the United States. And basically, it encompasses three different things: in exercises, physical exercises and postures, breathing techniques, and concentrating and thinking, such as meditation. So it encompasses exercise, breathing, and meditation. And I think that if anybody who goes to this extent and does physical exercises and does breathing and concentrates with meditation, they're probably controlling their diet. But actually, people who follow this have improvement in heart disease risk factors such as lipid profiles, body weight, blood pressure. And actually, they did a study showing that it reduced blood pressure, LDL cholesterol, and body mass really went down after doing this type of exercise, as long as with a vegetarian diet. So if you're going to go out for it, go out for it all the way, or at least do the exercise part of it. But yoga, wonderful system of whole body medicine. And our last systems of whole medical system, this is Chinese herbal medicine. I'm from New York, and I've been to Chinatown a few times, and I actually went into one of the shops, and it looks just like the picture you see. You get these little wood drawers, and each of those drawers contains herbs. And when you go see a Chinese herbal medicine doctor, they actually prescribe a mixture of these herbs that you actually boil on your stove. So you make this tea with this, you make this concoction with the tea with boiling water, and it seeps out all the constituents in these Chinese herbal medicine. But actually, these medicines, Chinese people actually use this for heart disease. And you could also use Qigong, which is basically an energy medicine, and you all have heard of acupuncture. All of these fall into the realm of Eastern medicine, and they're all considered what they call whole medical systems, but they actually, a lot of people practice this for heart disease. I hope you enjoyed my presentation. If you have any questions, this is a good time to ask, and I'm very happy you joined me. In conclusion, Western medicine can be life-saving. If you need a valve replacement, or if you need a PCI, you got to do what you got to do. But the goal is to reduce your risk factors, and reducing risk factors is diet, exercise, and also maybe incorporating some functional foods and herbal medicine into your world. Also read about CAM therapy, and there's some new stuff out there, and it really works very well, especially what I mentioned today. The references listed here can help you make a decision on what you want to do. It'll teach you a lot of things about functional foods and herbal medicines, and I think you'll really enjoy it, especially a lot of Chinese authors, a lot of research from China, India, the Middle East have done some great research with herbal medicines and heart disease, and nothing wrong with learning more. So thank you very much for joining my presentation, and I hope you have a wonderful day.